You're listening to the Life with Old Dogs podcast, and I'm your host, Dawn Mimnaugh, primary caretaker of all of our wonderful senior German Shepherds right here at Woody's Place Senior German Shepherd Sanctuary. Hey there, and welcome back to the Life with Old Dogs podcast. This week, we are covering canine elbow dysplasia, or CED. All right, that is what we're covering in our 20 most common health issues in senior German Shepherds, and we're up to number 11 of the 20. All right, CED is a developmental orthopedic disease that affects the bones and joints in our fur friends' elbows. That sounds horrible. That does not sound like fun at all. It is thought to be caused by abnormal growth or development. Abnormal growth or development of the bones and joint cartilage in the elbow. Okay. And then, in addition to that, it leads to pain and stiffness and even lameness. So if you have a fur friend who is, not wanting to use their front legs too much, you might want to pay attention here. So CED, obviously it can occur in any breed of dog. It is particularly common in large breeds and especially in German Shepherds. In fact, CED is the most common cause of front leg lameness in larger breeds. And we've seen it several times here at the sanctuary. In fact, we have Brandy in our care who has it. She was diagnosed. She came in January 2018. I think she was diagnosed around March or April of 2018. So she came in January 2018. Yes, January 2018, was diagnosed around March 2018. So we noticed pretty much right away. Yeah, and there's no cure for CED. That's unfortunate. There's no cure for CED, but there is a number of treatment options available to help reduce the symptoms and improve the quality of life for our wonderful fur friends affected by CED. Okay, so I touched briefly on what causes elbow dysplasia in senior German Shepherds, but according to the American College of Veterinary Surgeons, CED, they say it's a multifactorial disease involving multiple developmental abnormalities in the elbow joint. And it is believed to be a combination of that and genetic and environmental factors that contribute to CED, again, which can lead to arthritis and other joint problems, all of which are unfortunately painful. Okay, so let's jump into the signs of CED in senior German Shepherds. The number one is obviously pain. Okay, they have pain in their. You can tell they have pain in their front legs. There may be stiffness, lameness, trouble using their elbow or elbows, because they can have it in both. It's not just exclusive to one elbow. It can be in both. An unnatural gait. Okay, you could tell they're not walking quite right and something is up. They have an unwillingness or an inability to exercise or walk. They may plop down instead of lay down. And when they do that, when we have Brandy right now who does it, she'll plop down. Rock, he used to plop down, and they let out this groan. It just kind of reminds me of a balloon deflating almost when they're laying down. And it's sad. It's definitely sad. When they're laying down, they may have trouble shifting positions because they don't want to put weight on the elbow or elbows that are causing them pain. They may whine and or pant. Some people think that panting is just because the dog is hot. Well, no, that's not true. Panting can be and often is a sign of pain, and anxiety as well, stress and anxiety. So, and the last thing is, and this is noticeable in Brandy, and you could do this. This is something you can do right now if you think your dog has elbow dysplasia. Excuse me. Their elbows. Okay, their elbows should be pointing straight back, right? So if you're looking at your dog from behind, you should be looking at their elbows. They should be pointing straight back. Typically, dogs who have elbow dysplasia, their elbows are not pointing straight back. They're kind of pointing in toward their bodies as opposed to pointing straight back. So that's something you can do right now, is look at your dog from behind and see if their elbows are pointing in toward their body. And that's a pretty good sign that your fur friend may have elbow dysplasia. Okay, so how is elbow dysplasia diagnosed? Well, you looked at your dog's elbows. They're pointing in. Now, you're concerned. You suspected something was up, but you didn't know that it could be elbow dysplasia. So now you're concerned. What you want to do is you want to get your dog to your veterinarian as soon as possible. And I sound like a broken record. I think I've said this just about every podcast episode in season 3, but I am. So when something is amiss with any of our senior German Shepherds, I don't mess around. I don't wait. I don't, I shouldn't, how do I say this? Like, I'm not like a hypochondriac with the dogs. Like, I don't run them up to the vet just because, someone's sneezing a whole lot. I don't do that. I mean, that's a poor example, but, if I really feel like something isn't right, I don't mess around. I make an appointment right away, and I take the dog up to our trusted veterinarian as soon as possible. And my reasons for this are the dogs are the masters of hiding the fact that they're in pain. Them and cats. Cats, I think, are even better at hiding that they're in pain. But dogs will hide the fact that they're in pain. So if I'm seeing something, that tells me that this dog has already been in pain, and I need to have this addressed right away, because now I'm seeing it and I know the dog's been hiding it. So that's a big concern for me. Also, because if something's wrong, I'm afraid that it may be too late to do something about it, and I don't want it to be too late. I want to handle it as soon as possible, because obviously handling something earlier gives us the best possible outcome that we can have. So I want to address it early for the best possible outcome that we can have. And finally, because I don't want any of our senior German Shepherds being in pain. I want them to be happy. I want them to be healthy. I want them to have the best quality of life they can possibly have. So if I see that any of our seniors are in pain and discomfort, it really hurts me to see that. And I genuinely want them to be well. So I'm not messing around. I want to get them up there as soon as possible. And I would think you would want the same thing for your senior German Shepherd too. So if you see something going on, get your fur friend up to your veterinarian as and I say up because I live in a rural area in the mountains, and our trusted veterinarian's 45 minutes up the mountain from here. So but yours might not be. Bottom line, get your dog to the vet right away. When you're there, your veterinarian is just going to perform a physical examination. She's going to want to watch your fur friend walk or attempt to walk. She's probably going to gently manipulate the elbow or elbows to see, what she thinks, to hear if there's like any sort of crunching going on. If if there's any resistance from your dog, to have the elbows manipulated, all that good stuff. She may even want to do some blood work to rule anything out. And most likely she's going to want to take an x-ray or two to see what's going on with your dog's bones. So that's probably what's going to happen. If she determines that it is elbow dysplasia and it's severe, she's most likely going to refer you to an orthopedic veterinarian for further testing and possibly surgery and rehabilitation. Hey there, folks. This week's episode is being sponsored by The Shepherd Shop. The Shepherd Shop sells German Shepherd and dog-related merchandise, as well as our one-of-a-kind Woody's Place merchandise, with proceeds supporting Woody's Place Senior German Shepherd Sanctuary. So to check out the Shepherd Shop and support the sanctuary, head on over to www.wpsgss.org/Shepherd Shop. That's SHEPHERDSHOPPE. And now, back to our episode. Now, treatment for elbow dysplasia depends on the severity of the dysplasia. Mild to moderate cases, treatment may most likely will include pain management, such as an NSAID like Rimadyl, Carprofen, gabapentin, something along those lines, and maybe even cortisone injection. And therapy such as hydrotherapy and or maybe even acupuncture and massage. That's not going to work with severe cases of elbow dysplasia. Severe cases, that's most likely going to require surgery and then physical rehabilitation in addition to that, as well as pain management, such as an NSAID, maybe even tramadol as well, depending on how bad it is. And again, as I mentioned earlier, early diagnosis is essential for the best possible outcome for our fur friends with CED. Because the goal of treatment is to slow the progression of the disease to keep our fur friends as comfortable for as long as possible, which is a pretty realistic goal if it is caught early enough. Catching it is the hardest part, honestly, because as I said, our fur friends put on a good front when they're in pain. So it's really important to pay attention and keep an eye on our fur friend as they age to look for any signs and symptoms of CED. So Brandy has CED. She came here in January 2018 and was diagnosed, I think, right around March or April of 2018. And it was lameness. That was the first thing we noticed. And one of our volunteers at the time noticed her elbow turning in. I hadn't even noticed it, but one of our volunteers was very tuned into her elbow. She picked it up right away. And then we were able to start treatment for her. We did hydrotherapy for her to help her over her lameness. And that's another thing. In the beginning, they may not need any sort of pain management and or therapy all the time. It may be just when they have flare-ups, but typically, as the disease progresses, they are going to need help of pain management and possibly therapy on a more consistent basis. Okay, I want to go over some of the tools that in our toolbox that we employ for our senior German Shepherds with CED to keep them comfortable as the disease moves along. So the first thing that we are I personally, I'm a real stickler about this, is keeping them at an ideal weight. It is no secret that if you have an older dog or even a younger dog, any dog that's overweight, it is flat out not good for them in any way, shape, or form. It's not good for their joints. It's not good for their cardiovascular system. It is not good for their mental well-being if they have trouble getting up and moving around and they're taking just a few steps and they're panting unbelievably because it's too much on them carrying all that extra weight around. All right. So no, they have to be at an ideal weight. In fact, as they get older, it's actually better to keep them on the slimmer side than maybe just like, I don't want to say like a lot underweight, but maybe just like a pound or two under the ideal weight as opposed to at the ideal weight, because the less stress on their joints, the better it is for them as they age. All right. So I'm a real stickler about that. Short, frequent walks, doing only what they can when they can. Now, some days are better than others. Like Brandy, we'll use her as an example right now. Sometimes she'll want to just go outside and just kind of like mill around right out back outside the house. She don't want to go for a walk. She'll just want to mill around. Or if I'm going over to the goat and chicken yard, she'll want to come over there with me and she'll start to eat chicken feed with the chickens. Brandy blends in wherever. She's with the other dogs and she's doing dog things. Then she's in the cat part of the sanctuary and she's eating cat food and laying on cat beds and being a cat. And then we go outside to the goat and chicken yard and Brandy's eating, goat feed and chicken feed and being part of the goats and chickens. She just blends. But short, frequent walks, doing whatever they can do. Some days she'll go for a big walk around the sanctuary with us. Other days, if she's feeling good, it might be two. Typically, she's only doing one big walk a day sometimes. But most of the time it's a short walk around the sanctuary and then just kind of milling around out back. Hydrotherapy and massage. So we have incorporated hydrotherapy before. Unfortunately, there's no facility close to us. The closest one is an hour and 15 minutes one way. But if it is absolutely necessary, we will do it. Massage, we do have massage device here at the sanctuary and we will use it. And they love it. They love it. Dr. Hemp Oil talked about this. I sound like a broken record. Trust me when I say this is not a paid advertisement. I just love this product immensely. I mean, it is so good for so many different things, but it definitely helps keep pain in check and without being super invasive and, it's not harsh in any way, shape, or form on in our senior German Shepherds. It's a natural product, so I like that. Their product is amazing. Their sales team is incredible, and they have a lot of research to back up what they're selling. And I truly believe in that product, and I've seen it with my own two eyes, especially with Nona and her anxiety. High quality orthopedic dog beds, like the Big Barker dog bed. Oh, I love this bed. Oh my gosh, I love it. I love it. I love it. So when you have a dog with elbow dysplasia, you don't want a bed that's high off the ground or that the dog has trouble moving around on. So we have Kunla beds as well. I think I have three out still, and the rest I put away for now. They're nice. They're nice, and it depends on the resident that we have. Some use them, some don't. Now, Nona loves them. Nona loves the Kunla beds, and I typically have like a Sherpa mat on the bed and also a blanket on top of that, and she loves it. She can usually be found on a Kunla bed. Prince, heck no, it's not happening, and Brandy, no way. Now, both of them have mobility issues. Brandy has elbow dysplasia and arthritis, and Prince has arthritis and degenerative myelopathy. And if you watch these dogs try to get on these beds, they're not very stable. And I think it hurts. I think it hurts them trying to get on these beds, and they just don't like them. So I prefer the big Barker dog beds for dogs with mobility issues and for dogs who have arthritis and any sort of dysplasia. Plus the orthopedic bed itself, I think it's like 5 or 6 inches thick. These beds are so comfortable. I will put 2 together and I'll lay down on them myself. And I have spinal stenosis and I love these beds. Savvy and I'll curl up and lay on one of the bed or 2 of the beds together. All right, moving on. Heated dog mats, and all. It's like a heating pad for humans, only they're supersized for dogs. And I'll put them on top of the big Barker dog bed. So, excuse me, I was going to sneeze. The heating mats. Not all of our residents love them. Now, Brandy loves it. She loves her heat mat. She'll lay on that heat mat all day. She loves it. Prince, not so much. So once the mat starts to heat up, he jumps off his bed. It's like someone lit a firecracker under his butt. He doesn't like it. And I've come to the conclusion that maybe he thinks he peed the bed because it's warm and he's not sure, but he doesn't like it. He's not sure of what it is, and he's not having it. So no heating mat for Prince, but Brandy loves the heating mat. All right, no stairs or very few stairs. Little story here. The house that we're in now, we moved here 8 years ago. We left our beautiful Beaver Mountain log home about 40 minutes north of here to be closer to my husband's work. And as we were looking for another house to move to, we drove past this house several times for 2 years, folks. And my husband liked this house. Mr. Woody's place liked this house, and it was a hard no for me. In fact, I said to him at one point when he really kept trying to sell this house to me, I was getting irritated, and I said, my exact words were, and I quote, "There's no way in hell I'll ever live there." Well, as you know, Mr. Woody's place got his way, and I did not. But one of the selling features of this house for me was no stairs or very few stairs. So we have a sunken Florida room, and there's like these 3 cattywampus weird steps. I don't know who developed or designed this house, but they are the weirdest steps and whatever. Even though they're stairs, they're not typical stairs. They're elongated. They're more like platforms that go down into the Florida room as opposed to steps. So they're not that bad. They're not that bad at all. And dogs like Brandy, she can get up and down them okay. Even DM dogs, I can get them up and down those platform steps no problem because they're not steep. So no stairs or very few stairs for dogs with elbow dysplasia. And no jumping up on furniture or beds or in a vehicle, and no jumping out of vehicles or a bed or, sofa or whatever. Just no jumping. We want no or low impact on their elbows. So absolutely none. If you have to incorporate ramps, that's fine. If you have to lift them up, that's fine. Use a hammock to get them up, that's fine. But just don't let them jump, even if they want to, right? Because we have some senior German Shepherds in our care that have arthritis, and like Prince and DM, and he still tries to jump out of my Jeep. And that we can't allow that. We can't allow that because even though they think they can, it could do them more harm than anything. Area rugs. anybody who's been here to the sanctuary, I'm sure they know by our videos that we have area rugs all over the place, but we have hardwood floors, we have tile floors, we have linoleum floors. All are hard, slippery surfaces. Okay. So I have area rugs. I have my nice area rugs, and then I have my cheapo Dollar General area rugs that if something happens to them, I don't care. I'm picking them up, I'm throwing them out, I'm going to the Dollar General, I'm spending $15 and I'm getting another area rug. We have area rugs all over the place for several different reasons. DM dogs need area rugs. Okay. Any dog that has mobility issues needs area rugs on hard surfaces so they have traction and to avoid slippage. They can really hurt themselves if they don't have traction under their feet and they're trying to walk. In fact, if you have a dog with DM or mobility issues and you have a hardwood floor, you know for a fact they either don't or will refuse to walk across the hardwood surface because they don't have the confidence to do so, because they know they're going to slip and possibly hurt themselves. So we have the rugs for that. And also for dogs like Brandy who have some sort of dysplasia, elbow dysplasia or hip dysplasia, the area rugs help with the impact of walking. Okay. It helps reduce the blow on their joints from the impact of walking. All right. So that's why area rugs are important to have. Again, we use veterinary approved pain medication. Rimadyl, carprofen, gabapentin, tramadol if we have to. We also use supplements such as omega-3s, glucosamine chondroitin, collagen. That's another good one that we'll use. And turmeric. I'm a nut for turmeric. I use it for our senior German Shepherds. I take turmeric every single day. I'll put it in something I'm eating. I'll put it in my smoothie. I don't even taste it anymore, but I use it every day. One little note about turmeric, and then it's pretty much going to be it after that. It can thin your blood, and you need to be careful. You need to be careful with that. And I actually have to cut back on a little bit because I was recently at the doctor's a while ago, and I had to get an injection, and I started to bleed. And the nurse actually asked, did I have thin blood? And I said, no, I don't think so. And I said, that's the first time I've ever been told that. And I started talking to her about turmeric, and then discovered it can be a blood thinner. So you have to be careful if you have a dog that has thin blood, it could be a problem. So you have to be careful with that. But anyway, turmeric is an anti-inflammatory, so we do incorporate that. So, all right. Now, in the blog post, I put there's definitely a picture in there about elbow dysplasia. So you want to check that out. Got the list of all the symptoms there. My little tools of the tools we use for helping our seniors with canine elbow dysplasia. And there's a list for our Amazon preferred product page. I've talked about this before. Our Amazon preferred product page is not the same thing as our Amazon wish list. Okay. Not every organization is eligible for a preferred product page, but we are for some reason. I was so happy when I found this out. The preferred product page is not really for us. It is for you to go on there and to see what it is that we use, the products we prefer for our senior German Shepherds here at the sanctuary. All right. And we try a lot of stuff here. In fact, I have a closet. I donate a lot to Destin Animal Shelter or other rescues, maybe products that were donated to us or products that we thought were going to be good and maybe they weren't exactly what we wanted. Of course, I'm not going to throw them out. I'm going to try to recycle them to another organization that could use them. So this Amazon preferred product page, our products that we believe in that actually work for our senior German Shepherds, and we're passing that information along to you so you're not throwing your money away. It is the same thing with Dr. Hemp Dog. I've included a link for their product in just about every blog post for season 3. We truly believe in this product, and they gave us a discount for you if you would like to try Dr. Hemp Dog. We have a link on the blog post and the discount code that you would use for 10% off of Dr. Hemp Dog. And there's no limit. You can use that as much as you want. So I will be sure to include the blog post link in the podcast show notes. And all you'll have to do is click on the link and it'll take you right to the blog post. All right, that is it for this week. Next week, we are going to be talking about EPI. It's endocrine pancreatic insufficiency. I am happy to say we have never had that here at Woody's Place Senior German Shepherd Sanctuary. So I am bringing on the fine folks of EPI for Dogs to talk about endocrine pancreatic insufficiency, because that is also a common health issue in German Shepherds, older German Shepherds. So I'm excited for that. All right, folks, I am tired. It's been a long day and about ready to sign off here. I just want to wish you all well, wherever you are, whatever you're doing. Hopefully you are well. I know COVID has been running rampant where we are, and we're in the sticks, but I just hear so many people are having this Omicron variant of COVID right now. So if that's the case where you are, I wish you well and your loved ones. And hopefully it'll subside soon. All right. Anyway, until next time, be well, folks.